Hi everyone. So now uh, I would like to welcome all of you back to USMLE with Varun. This is part 4 of our psychiatry series for USMLE Step 1. In this video, we will cover anxiety disorders, obsessive compulsive disorder, personality disorders, sleep disorders, and finally a rapid psychiatry revision framework for the exam. Before beginning with the lecture, I would like to request every one of you to please subscribe and keep supporting. This lecture series is provided free and is open access for all the students who wanted to study for USMLE or NEET PG. If you find it useful and wish to support its continued development, voluntary contributions are welcome. All content will remain free to access. You can pay with the link that is provided in the description and the pinned comments, and also that's present on the screen. So you can pay with UPI, cards, net banking, wallets, and PayPal on the Razor Pay link. So if you really want, so now this is the last video of our psychiatry lecture series. If anybody wants psychiatry high yield notes, you can just DM at USMLE with Varun@gmail.com, and high yield notes will be sent in 48 hours post payment of a nominal fee. So by the end of this video, you will learn how to diagnose anxiety disorders using timelines and triggers, differentiate panic disorder, GAD, phobias, PTSD, and OCD, understand first line treatments, identify personality disorders using cluster uh, patterns, recognize important sleep disorders, and solve USMLE style pattern questions. What are anxiety disorders? Anxiety disorders occur when fear or worry becomes excessive, lasts too long, and interferes with daily functioning. Patients commonly experience palpitations, sweating, tremors, chest tightness, shortness of breath, and fear of losing control or dying. Whenever you see an anxiety question, ask five things for yourself. Is there a trigger? How long have symptoms lasted for? Are symptoms sudden or chronic? Is avoidance present? Is there any trauma history? Timeline plus trigger usually gives us the diagnosis in any kind of questions that are related to anxiety disorders. A panic attack is a sudden increase of intense fear that peaks within 10 minutes and resolves within an hour. Symptoms includes palpitations, chest pain, shortness of breath, dizziness, fear of dying. If ECG is normal and episodes recur, you have to think about a psychiatric cause if these symptoms are present. And there is a normal ECG and there are repeated episodes of these symptoms, then you have to think about a psychiatric cause. Panic disorder means recurrent unexpected panic attacks plus persistent fear of having more attacks for at least 1 month with avoidance behavior. The key exam clue in any panic disorder question is that the patient says that he's scared of getting another attack. Panic attack versus panic disorder. A panic attack is a single episode and can occur in many disorders, whereas a panic disorder means repeated attacks plus continuous fear of recurrence. Recurrent attacks plus worry equals panic disorder. Generalized anxiety disorder is excessive, uncontrollable worry about many things occurring most days for at least 6 months. Symptoms includes restlessness, fatigue, poor concentration, irritability, muscle tension, and poor sleep. Mnemonic is chronic. So the key exam clue is that there's chronic worry, and the question also mentions that it lasted for it is occurring since previous 6 months. Phobic disorders. Types includes specific phobia, social anxiety disorder, and agoraphobia. Key feature is immediate anxiety when exposed to a specific trigger and strong avoidance behavior. Panic disorder has sudden attacks with no trigger required. GAD has daily chronic worry for 6 months. Phobia causes anxiety only with a specific trigger and avoidance. So, uh, we need to differentiate between panic disorder, GAD, and phobia. We need to understand this differentiation very well because these are very much tested on any competitive exams. We need to understand that panic disorder has sudden attacks with no trigger required. GAD has daily chronic worry for 6 months, whereas phobia, anxiety is only present with a specific trigger, and also there is presence of avoidance. PTSD occurs after exposure to death, serious injury, or sexual violence. Core features includes re-experiencing, avoidance, negative mood or thinking, and increased arousal. Duration must be more than 1 month. PTSD symptoms. We can remember this using the mnemonic IAMA, IAMA, IAMA. So I is intrusion with nightmares and flashbacks. A is avoidance, avoiding reminders. M is mood changes or negative mood like guilt, detachment, and hopelessness. A again is arousal. Arousal occurs and presents with hypervigilance, poor sleep, and irritability. Intrusion, flashbacks, nightmares. Avoidance, avoids reminders. Mood changes, guilt, detachment, hopelessness. Arousal, hypervigilance, poor sleep, and irritability. Acute stress disorder has same symptoms as PTSD, but the duration is from 3 days to 1 month after trauma. If the symptoms persist for more than 1 month, it becomes PTSD. Now, we need to understand differentiation between PTSD and acute stress. Between PTSD and acute stress, the only difference is that the timeline that matters. Only the timeline differs between PTSD and acute stress. Acute stress disorder uh, timeline is around 3 days to 1 month, whereas PTSD occurs more than 1 month after trauma. Symptoms are similar, only the duration differs. Treatment of anxiety and PTSD. First line treatment is selective serotonergic reuptake inhibitors and cognitive behavioral therapy. Benzodiazepines are used short term for severe acute anxiety, but not long term because of dependence as a side effect. Exam rule is that chronic anxiety should always be managed with SSRI and CBT, whereas if there is acute severe panic, short term benzodiazepine, this is not used for long term management because it can lead to dependence. Obsessive compulsive disorder. OCD consists of obsessions, which are unwanted intrusive thoughts, and compulsions, which are repetitive behaviors to reduce anxiety. Patients know these thoughts are irrational, but they cannot control these obsessions and compulsions. Patients know that these thoughts are irrational, but they cannot control them. Okay, so now we'll understand and try to differentiate between obsessions and compulsions. Obsessions includes fear of contamination, fear of harming others, symmetry, sexual or religious intrusive thoughts. Whereas compulsions includes repeated hand washing, checking locks, counting numbers, and arranging objects. So obsessions and compulsions. So these are the different kinds of examples. Obsessions includes fear of contamination, fear of harming others, always needing symmetry in their in whatever they come across, sexual or religious intrusive thoughts. Compulsions includes repeated hand washing, checking locks, counting numbers, and arranging objects. USMLE questions. Uh, USMLE tests OCD very often. We need to understand whenever there's an insight present, we need to think about OCD. If there is no mention of an insight, we need to think about a psychotic disorder. Patient washes hands for hours and knows it is excessive, becomes anxious if not done, and behavior interferes with life. So, insight persists means it's OCD, not psychosis. Treatment of OCD. First line treatment is high dose SSRIs plus CBT using exposure and response prevention. Second line is clomipramine, which is a tricyclic antidepressant. Benzodiazepines are not main treatment, so we need to avoid them. OCD pattern case. So, patient with a fear of germs washes hands 50 times a day, knows it is excessive, feels relief after every wash, but also knows that they are washing too much, but they can't control this urge of washing. So, this can be diagnosed as obsessive compulsive disorder. Personality disorders are long standing patterns of thinking and behavior that begin in early adulthood, are inflexible, and cause relationship and work problems. Key exam clue in any questions related to personality disorders includes chronic. Their chronic conditions remain stable over years, and they are not episodic in nature. Personality disorders are not episodic in nature. So, personality disorder clusters. When we try to study about personality disorder clusters, so there are three different clusters: cluster A, cluster B, and cluster C. Cluster A includes odd or eccentric personalities like paranoid, schizoid, schizotypal, whereas cluster B includes antisocial, borderline, histrionic, and narcissistic. This is a kind of dramatic or emotional personality. Cluster C is a kind of anxious or fearful personality, and the types includes avoidant, dependent, and obsessive compulsive personality. Cluster A personality disorders. Now we'll study about paranoid personality. Uh, Features includes distrust, suspicion, believing others want to harm them, reading hidden meanings into normal events, but no hallucinations or delusions are seen. Exam clue is that they are always suspicious, but reality testing is intact. Reality testing is intact is something that we have to remember in paranoid personality disorders. Cluster A, schizoid personality disorder. Features includes social isolation, little interest in relationships, emotional coldness, preference to be alone, and no psychosis. The key difference between paranoid and schizoid is that there are no hallucinations. We've already discussed that in paranoid also there are no hallucinations and delusions. Schizotypal personality. Features includes social anxiety, odd beliefs, magical thinking, strange appearance, and ideas of reference. This schizotypal personality looks like mild schizophrenia, but without true psychosis. Cluster B disorders includes intense emotions, impulsivity, unstable relationships, and poor self-control. This includes antisocial personality, borderline personality, histrionic personality, and narcissistic personality. And these cluster B disorders can be memorized using a mnemonic ABHN: antisocial, borderline, histrionic, narcissistic. Now we will study about each of them. Antisocial personality disorders features includes lying, stealing, aggression, no remorse, and repeated legal problems. Diagnosis requires an age of above 18 years and it should be diagnosed as conduct disorder before the age of 15. Only after age of 18 that we can mark some person or a patient as with diagnosed antisocial personality disorder. So this antisocial personality disorder, which is a subgroup of cluster B personality disorder, features includes lying, stealing, disregard for others' rights, no remorse, aggression, repeated legal problems. Minimum age criteria is 18 years to mark someone as with antisocial personality disorder. Before the age of 15, we can only diagnose them as conduct disorder, patients with conduct disorder. Exam clue in any question related to this is that they're charming but criminal, and they also don't express any kind of guilt or there's no remorse over the mistakes they do. Now, coming to borderline personality disorder, features includes unstable relationships, fear of abandonment, self-harm, emotional instability, chronic emptiness, anger, and identity disturbance. So we can memorize these features of borderline personality disorder using the mnemonic I despair. So these includes these can be memorized using the mnemonic I despair. The features includes unstable relationships, fear of abandonment, self-harm of suicide, emotional instability, chronic emptiness, anger, and identity disturbance. Identity disturbance, emotional instability, self-harm or suicide attempts, relationship issues. Histrionic personality disorder. Patient is overly emotional, dramatic, attention seeking, seductive, and shallow in emotions. So, histrionic personality disorder features includes this is very much tested on USMLE Step 1. So we need to understand what are the features of histrionic personality disorder. Uh, Patient is overly emotional. Patient is dramatic, attention seeking, uh, is very shallow in emotions, always does something like acting in their life. They're always shallow in emotions, and no emotion comes deep out of their heart. Okay, so but they are too dramatic in normal situations. They always seek attention. Narcissistic personality disorders includes features includes grandiosity, need for admiration, lack of empathy, sensitive to criticism, can't bear someone criticizing them, and they always feel superior to everybody living with them. They also have a very fragile self-esteem. The exam clue for narcissistic personality disorder identification and questions is that they're always arrogant and their self-esteem is very fragile. So many of our politicians have this kind of narcissistic personality disorder all over the world. Cluster C overview. Uh, uh, when we try to study something about cluster C, we need to understand that cluster C personality disorder patients are generally anxious and always fearful. Uh, so it is characterized by anxiety and fear. It includes avoidant, dependent, and obsessive compulsive personality disorder as the types. Mnemonic is ADO. So cluster C personality disorders includes avoidant, dependent, and obsessive compulsive personality disorder. Now let's study about avoidant personality disorder. Patient wants relationships but avoids them due to fear of rejection and feeling inadequate. So this avoidant personality disorder is a lifelong pattern. The key difference from social anxiety is that this is a lifelong pattern, whereas social anxiety is just on and off. Whereas this avoidant personality disorder is a lifelong pattern. They always want relationships but avoids them due to someone rejecting them and always feel inadequate. They are too much sensitive to criticism. They are hypersensitive to criticism and always inhibit themselves from getting into social settings. Coming to dependent personality disorder, the patient cannot make decisions, fears being alone, clings clinges to relationships, clings to relationships, and tolerates abuse to avoid separation. Obsessive compulsive personality disorder features includes perfectionism, rigidity, or they're always obsessed with rules. They are mostly workaholic and controlling kind in nature. They always tend to control people around them. They're someone like they try to identify themselves as a perfectionist. They're always rigid. They're obsessed with rules and orderly behaviors. The key difference from OCD is that these OCPD people, their behavior feels correct to the patient, correct to patient. Okay. So when we try to differentiate between OCPD and OCD, obsessive compulsive personality disorder and obsessive compulsive disorder. So OCPD and OCD. OCD thoughts are unwanted and they are ego dystonic. Patient knows it's irrational, whereas OCPD patients uh, believes that the behavior is correct. This is a personality trait by itself, whereas this is not. They know that it's irrational, but these people feel like whatever they're doing is true, and that's the right thing to do. There are no true obsessions or compulsions. Believes that their behavior is correct, and this is their personality trait. Important sleep disorders includes insomnia, narcolepsy, obstructive sleep apnea, night terrors, and sleepwalking. USMLE focuses on daytime sleepiness and REM versus NREM patterns. So we need to understand and try to answer questions on daytime sleepiness, and we also need to understand the key differentiation between REM and NREM sleep. Insomnia is characterized by difficulty falling asleep, difficulty staying asleep, or early awakening presenting with daytime fatigue. Causes includes anxiety, depression, caffeine, medications, and poor sleep hygiene. Treatment for this insomnia is sleep hygiene and cognitive behavioral therapy. We can prescribe sedatives for short term if needed, but they shouldn't be prescribed for long term as they may lead to dependence. Narcolepsy features includes excessive daytime sleepiness, sudden sleep attacks, cataplexy, which is triggered by emotions, sleep paralysis, and hallucinations. Cause of this narcolepsy is low orexin or hypocretin, which is a hormone. So the exam clue is patient collapses while laughing. We have seen uh, many examples over many TV series and movies where the person has excessive daytime sleepiness. They suddenly get to sleep whenever they get into extreme emotions. There are sleep attacks. There is sleep paralysis, and they hallucinate when they get into sleep. So this is because of low orexin. Obstructive sleep apnea presents with loud snoring, daytime sleepiness, and morning headaches. It is mostly seen in people with obesity and hypertension. This is both a cause and also a feature of obstructive sleep apnea because obesity and hypertension causes obstructive sleep apnea, and obstructive sleep apnea further worsens hypertension and cardiac diseases. So, obstructive sleep apnea is probably a vicious cycle that needs to be cut at any stage. It has to be taken seriously. So, treatment includes CPAP and weight loss. Now we'll try to understand differentiation between night terrors and sleepwalking. So both night terrors and sleepwalking occurs during non-REM sleep. Night terrors includes screaming, autonomic activation with no memory. There is no memory of what have happened on the next day. Sleepwalking involves walking during sleep and again there's no memory on the next day. So these night terrors and sleepwalking occurs mostly in children, so they have to be observed. If they show any kinds of features related to night terrors and sleepwalking, both of them occurs during non-REM sleep. Now, we will get back to our gold standard pattern recognition, uh, possibility, and possible questions on USMLE Step 1, where we can identify using patterns from high yield questions. A 27-year-old woman presents with sudden episodes of palpitations, chest tightness, fear of dying. There's normal ECG. There's normal ECG. Okay. So this is the key thing, keyword. Uh, there is avoidance present, and there is fear of next attack coming up. So this can be diagnosed as panic disorder, and the key clues in this pattern recognition question is that there are recurrent attacks. We need to identify this pattern of recurrent attacks along with presence of avoidance and along with a fear of recurrence. So whenever there's this pattern in any step one question, you need to think first about panic disorder. Now let's discuss another case. There's a 35-year-old man, an elderly man, a young adult who has a daily worry for 8 months with muscle tension and poor sleep, worrying about job, health, family, and finances. Worrying daily for 8 months is the key word here. So, along with muscle tension, poor sleep, and fatigue. So, this can be diagnosed as generalized anxiety disorder. The pattern we have to identify in these questions is that there is chronic worry for greater than or equal to 6 months. 8 months is something that's mentioned in this question. So, whenever you see a pattern like there's presence of chronic worry for greater than or equal to 6 months, you need to think about generalized anxiety disorder. Now let's discuss about a third case. A soldier presents with nightmares, avoidance, and hypervigilance is also seen. This soldier is easily startled. There is hypervigilance for 4 months. So he has nightmares about what? He has nightmares about combat. He has nightmares about war, something he have fighted in, fought in. So this person avoids loud noises. There is avoidance seen in this soldier, and there are also nightmares seen. There is hypervigilance, which is present in this patient, and the symptoms are lasting for greater than 4 months. So we can diagnose it as post-traumatic stress disorder. The pattern you have to identify in any question related to PTSD is that there's trauma and symptoms like avoidance, hypervigilance for greater than 1 month. So whenever you see such kind of pattern, think about post-traumatic stress disorder. Now let's discuss a case on OCD. So there's a student has repeated thoughts of contamination, washes hands for hours, knows the behavior is excessive. He's in ego dystonic state, as we have already discussed. He feels relief after washing. All right. Okay. So if there's some pattern like this, you may need to differentiate sometimes between OCD and OCPD. So and something we have already discussed is that OCD patients are ego dystonic, whereas OCPD patients are egocentric. So this patient knows that whatever he's doing is excessive. So he's in an ego dystonic state. Okay, he's agreeing that what he's doing is mistake. He knows about that, but he feels relief after every washing, every hand wash, and washes hands for hours together. So this can be diagnosed as obsessive compulsive disorder. The key clue in any question related to OCD is that there's insight, and he has to do it to reduce anxiety. There's a compulsion to do it to do something to reduce anxiety. Now we'll discuss about pattern recognition of borderline personality disorder. There's a 23-year-old woman with intense unstable relationships, multiple suicide attempts, fear of abandonment. There is sudden anger and emptiness from inside. So whenever you see some question like this, you need to look upon, you need to identify key features like there's presence of emotional instability and there's a history of self-harm. As we have already discussed in borderline personality disorders, anybody with self-harming nature, with a fear of abandonment, always emotionally unstable, there is sudden anger, and always getting through uh, unstable relationships and a feeling of emptiness, we need to think about borderline personality disorder. The key pattern we have to identify in any question related to borderline personality disorder is that there's presence of emotional instability, self-harm, and feeling of emptiness. Now we will discuss few questions from USMLE. Question one, we'll try to differentiate between panic versus cardiac uh, cause. So there's a 29-year-old woman who has recurrent episodes of palpitations, chest pain, shortness of breath. There's normal ECG and normal troponin, but there's a fear of dying, fear of next attack. Okay, the most likely diagnosis in this case is panic disorder. Because there's normal ECG, you can eliminate a cardiac cause, and there's fear of dying, there's a fear of next attack. So let's look at the options. There's myocardial infarction, doesn't have a normal ECG for sure. Panic disorder might be pulmonary embolism. Normal ECG and normal troponin are not possibilities. GAD, there is. So we have to observe something that there is palpitations and shortness of breath and chest pain. These are not much typical of GAD, but they are more. These features are more particular and can be mainly related to panic disorder. Okay, so the pattern we have to identify in such questions is that there are sudden episodes, sudden recurrent episodes, and normal ECG, and there's a fear of recurrence or fear of next attack. So it can be diagnosed as a panic disorder. Uh, Question two, a patient washes his hands 40 times a day due to fear of germs. He says, I know this is irrational, but I feel anxious if I stop. But I feel anxious if I stop doing this. He only feels relief only after continuously doing it. So this can be diagnosed as OCD. So OCPD, the patient is egocentric. He doesn't accept that whatever he's doing is irrational. He believes that whatever he is doing is the right thing and continues to do that. Whereas OCD patient, there's insight present and there are also compulsions. Question three, a man has no close friends. He prefers to work alone, shows little emotion, and is not distressed by isolation. So a man has no close friends, no close friends. He distrusts, prefers to walk alone, social inhibition. Okay, shows little emotion, shallow emotions, and is not distressed by isolation, happy with himself. So the pattern we can identify in this question is that he's always isolated, he's emotionally cold, there is no desire for relationships. We can diagnose it as schizoid personality disorder. A patient suddenly collapses when he has an emotion, he suddenly collapsed. Has excessive daytime sleepiness and vivid dreams while falling asleep. There's presence of hallucinations. It can be diagnosed as narcolepsy. The pattern we have to identify in this question is that there's presence of cataplexy and also daytime sleep attacks. There are hallucinations seen, and yeah. Now, let's discuss another question. And in this question, we'll try to understand differentiation between PTSD and acute stress. A woman develops nightmares and hypervigilance 10 days after a car accident. 10 days after a car accident. This is a key thing. This timeline is the key thing. When we already discussed about PTSD and acute stress, we have discussed that timeline is the key in diagnosing and differentiating between both these conditions. So when we try to do so, we need to look at the timeline very particularly. Okay. So nightmares and hypervigilance. So both features are seen in PTSD and acute stress. Both are seen in both the conditions. But the key thing is that there's a mention of timeline of 10 days. So whenever there's trauma and symptoms whenever there is origin of symptoms in less than 1 month after trauma had occurred, it should be and it can be diagnosed as acute stress disorder, but not as PTSD, because PTSD is diagnosed only after if the symptoms arise after 1 month of an traumatic incident. The common exam traps for students who are sitting at a step 1 exam includes uh, that what the mistakes we do includes we do not call uh, panic uh, cardiac disease when tests are normal. Okay, we should not call panic disease as cardiac disease when tests are normal. Okay, we should not miss timeline for PTSD. We should not confuse OCD with psychosis. We should not use benzodiazepines long term as they can cause uh, dependence. We shouldn't forget CBT as the first line in any kind of psychiatric condition. So the rule includes always see at the insight and always look at the rituals before diagnosing it, before diagnosing some person as having with OCD. Common exam traps in personality disorders includes uh, per, diagnosing personality disorder as depression or anxiety. This should not be done. Uh, One thing is that we should not confuse schizoid with avoidant uh, personality disorder. We should not confuse OCD with OCPD. We should not confuse borderline with bipolar disorder. So personality disorders. It's something like there's chronic patterns since early adulthood. So always chronic. Uh, Panic disorder is something there's sudden fear plus fear of next attack along with normal cardiac tests. GAD, there is worry, chronic worry for greater than 6 months. Phobia, fear to a specific trigger. PTSD, there is onset of symptoms and features after 1 month of traumatic incident, whereas acute stress, the features are onset is seen before 1 month of the incident. So whenever we try to memorize personality disorders, we can actually use these tricks. So cluster A personalities are always weird. They are identified as weird when they go into a group of people. They are those weird kind of people. So paranoid people are always suspicious of everybody. They don't believe anybody. Schizoid people prefer being very alone, whereas schizotypal people are always strange. When coming to cluster B, they are always dramatic and wild. These include antisocial whenever there's criminal thoughts or criminal kind of behavior. Borderline, they're always unstable. Nobody knows how they behave after the next second. Histrionic, they're always dramatic and always look forward for someone looking up at them. So, narcissistic personality disorder, these people are always arrogant and they have very fragile self-esteem. They can't someone criticizing them. Cluster C personality disorders includes something related to worried kind of personalities. Avoidant, dependent, and OCPD. Avoidant are always shy. Dependent are always clingy, whereas OCPD people are always perfectionist in nature. They're more attracted to rules and laws, and they're always egocentric about what they do. Memory tricks in identifying sleep disorders includes narcolepsy. There is a presence of cataplexy and daytime sleep. There's hallucinations whenever they get into sleep. They get into sudden sleep when they come across sudden emotions. All right. So when we try to understand something related to sleep apnea, there's presence of snoring and obesity, and there is snoring in people who suffer with obesity and hypertension. Night terrors are mostly seen during non-REM sleep. there is no memory on the next day about whatever the hallucinations they've come across. Insomnia includes uh, there is a problem with initiating sleep, maintaining sleep, and also there is a very early morning awakening in these people with insomnia. So now we will try to rapidly revise the psychiatry series what I've been discussing since the last four videos. So anxiety disorders, the key is timeline and trigger. OCD disorders, the key is insight and compulsions. Personality disorders, there's a lifelong pattern. This is a chronic condition. Sleep disorders, we need to understand about REM versus NREM clues. So if you identify these four, diagnosis becomes easy. So whenever you see a question, you have to ask yourself before answering any question related to psychiatry, you have to ask yourself, is it an acute condition or a chronic condition? Is there any specific trigger? What's the duration of symptoms? Whether insight is present or not. Are there any drugs involved? Is there any medication history? Is there any history of drug abuse or substance abuse? Is there any history of traumatic incident they have come across? Is there any personality pattern for them? And is it something all along with sleep disorder or not? So in video one, we have discussed about the basics of psychiatry. In video two, we have discussed about psychosis and antipsychotics. In video three, we have discussed about mood disorders and drugs. In video four, we have discussed anxiety, OCD, and personality and sleep disorders. So, uh, uh, if you like any of them, you can go back and refer to all the four videos. So, I believe that we can be able to complete psychiatry uh, by the end of this lecture series. Anybody who watched these four videos in this lecture series can understand what's the most required and the high yield concepts for psychiatry that is tested on USMLE, NEET PG, and INICT. I would like to request everybody to subscribe and look forward for any upcoming lecture series. I'll be back in a week. Also, don't forget to subscribe. So, final examples. So, this is like the the gift that I can give to anybody who have been following the series, that is that timeline decides the diagnosis, acute or chronic. All right. Drug side effects are heavily tested, so we need to revise the key drug side effects that we have already discussed in the previous videos. Personality disorders are lifelong, they're chronic conditions. Insight is something that separates OCD from psychosis. Trauma and duration separates PTSD plus acute versus acute stress. One is so one condition is less than if the onset occurs in less than 1 month, and the other condition is if the onset occurs in after 1 month. So so one thing, the key for answering psychiatric questions on step one is that the key is identifying patterns in questions, not memorizing. When we try to memorize something in psychiatry, that's like you don't tend to remember anything of it when you go and sit in front of the exam. So the key is that we need to understand how to recognize patterns in questions. So that really helps us to get through the exam. So this lecture series is provided free. It is structured and clutter-free content with only high-yield concepts. So I would like to request everybody of you to subscribe for more step one and step two content. Keep supporting. Thank you.